So I'm very happy with the special session the Congress has done today on the importance of sightness for prognostic and predictive value in advanced colorectal cancer. All papers in which there was a value of anti-EGFR antibodies in advanced colorectal cancer with that issue of right colon versus left colon have been presented today in the plenary session, together with an introduction to understand the differences, the biological and clinical differences between right and left colon cancer, and also a discussion on the pros and cons and also how to interpret the data on this particular aspect. I think it has been a brilliant session with a lot of prominent speakers, and I think that story of right versus left is moving forward, and perhaps new clinical trials will address these two types of tumors in a different way. There were in many diseases, across diseases, very important trials on immunotherapy. The most successful ones were in non-small cell lung cancer, because some of them are going to change our practice. Immunotherapy is as good or even better in some trials that chemotherapy in first or second line of these deadly disease. So this is another opportunity for patients to enjoy a good period of control of the disease. And apart from lung cancer, because it's a very prevalent disease with a high impact in the society, we've got data on many other diseases, on the emerging role of immunotherapy, and this, I think, this will come very early to the clinical practice. There are a lot of emerging combinations, not only with immunotherapeutic agents, but also with drugs that may better modulate the immune system, providing a better outcome for patients. So a lot of science around this type of trials. In the breast cancer area, we got a presidential session in which the value of a CDX4 inhibitor was presented, showing an improvement over hormonotherapy alone. This is, I think, an important news because it's tackling the group of patients that have tumors that are hormonal sensitive, and this is another opportunity for them. So I'm very positive about these findings. Many of these trials were having overall survival as the main endpoint. So in many of them, these therapies, these technologies are going to prolong survival of patients. That at the very end is the main aim of oncology anytime.